I met a new buddy yesterday who's going to help save lives in the Hazleton area. I'd like you to meet Apollo, the surgical robot at Lehigh Valley Hospital, Hazleton. He was named by Megan Curtis, a 7th grader at Heights Terrace Elementary Middle School. She won a naming contest and was one of a group of students who got to actually work with Apollo at the hospital on Monday. We talked with her and another student in the Hazleton Area School District about using the machine and 2 doctors about the benefits of working with Apollo. Oh, and by the way, Curtis wants to be a surgeon one day. How did you settle on Apollo?
Well, I was in class and I was trying to figure out a good name for it, and it was kind of difficult, and then I thought about Apollo. He's a Greek god as well, and his name means healing, light, knowledge, and truth. So I thought it was really interesting to have that as a name for this intellectual robot who will perform surgical tasks.
What was it like working with it? I mean, is it as easy as it seems? What was it like as you're moving things around?
It's not as easy as using your own hands, but it's really interesting, and I think the surgeons here will be able to do it wonderfully.
When you're getting ready to be a surgeon, what do you think the technology is going to be like? I mean, can you even imagine what the world's going to be like at that point?
I don't even know. It's going to be crazy, I assume, but I'm hoping whatever we come up with will help us in the long run, helping people.
So you said you played like VR video games. I just got done playing the Star Wars one. I was fighting stormtroopers in that. Is it anything like any of this? Or?
I would say this is more like not really for fun. This is more for a purpose besides entertainment. But it was kind of a new experience for me.
Fun for you though too?
Yeah, it was really fun.
It makes our life a little bit easier, but I think the big plus is for the patients. I know that with the program that I'm following that was developed in Cedar Crest, our patients go home after hysterectomy the same day, and the procedure is relatively a lot less painful than other procedures, so we're sending those patients home without narcotic pain medication, which in this day and age with our narcotic problem in the area, I think that's a great thing, that we're not putting more narcotics out there, and a lot of patients are afraid to take narcotics. So because of this minimally invasive surgery, we can use less aggressive pain medications like Motrin, Tylenol, and a lot of these patients are going back to work in a week, so not only is their recovery much quicker, but it's much less painful.
So the Hazleton area is meeting Apollo today. What should they know as they get introduced to Apollo?
Well, despite having a nice, clever name, Apollo is basically an extension of the surgeon's hands and touch. So it's basically, people sometimes think it's the robot is actually doing the surgery on them. That's really not the case. We're, as surgeons, we're still doing the surgery. It's just the robot is giving us better visualization in different parts of the body that might be, hard to access, or previously we would have to make bigger incisions to access.
Ernest won an iPad, and I want to thank her because before Apollo, our robot friend was named Da Vinci SI Surgical System.